I have a human karyotype right here. However, this human karyotype is not normal. Normally, a human karyotype contains 23 pairs of homologous chromosomes, where each homologous pair contains two chromosomes, one from father, one from mother. However, what I am going to provide you here are karyotypes of abnormal conditions. This is due to chromosomal abnormality leading to genetic disorder. And from this video, you will be able to learn three things. Number one, identify the chromosomal abnormality and genetic disorder by looking at the karyotype. Number two, name the genetic disorder. And number three, write down the features of that chromosomal or genetic disorder. Here's the first question. In first question, you can see that there are three chromosome number 13. This is called trisomy 13, which is also called Patau's syndrome, which has following characteristics. Number one, presence of proboscis like the one present in mosquito. Number two, cleft lip, which can be present on both sides or on just one side, and cleft lip might also be accompanied with cleft palate. Number three, anophthalmia, that is absence of eyes. Number four, microcephaly, that is presence of small head. Number five, low set ears, that is the ear is positioned below its normal position. Number six, sloping forehead, which is visible from the side view. So from side, you can see that forehead is certain standard deviation away from the vertical. So what we have? We have proboscis, cleft lip with cleft palate, anophthalmia, small head or microcephaly, and deviation from vertical, which is called sloping forehead. Okay. Second question. In second question, you can see that we have trisomy 18. So the karyotype is of Edwards syndrome. E for 18, E for Edwards syndrome. Here are the features of Edwards syndrome. So presence of small mouth. The mandible, it is deficient, which is also called micro, means small. Agnathia means mandible. Low set ears, the ears are at a position lower than its normal position. Overlapping fingers and club-shaped feet. Question number 3. Here you can see that there is only one X chromosome, or there is monosomy X. So this is the karyotype of human female with or lacking one X chromosome. So the condition appears in a female, and this condition is called Turner's syndrome. So monosomy X, that's Turner's syndrome, which is a syndrome of female, and due to just one X chromosome or deficient of one more X chromosome, the features are less feminine. There are two features, externally visible features and internally present features. Let's look at externally visible features. So there is webbing of neck, there is broad chest with widely spaced nipples. The forearm is far away from the body, or called cubitus valgus. The person has a short stature. The female, the lady, has a small stature. Okay, internally, there's horseshoe-shaped kidney, coarctation of aorta. Instead of having tricuspid, bicuspid aortic valve, ovarian streak, amenorrhea, that is menstruation does not take place, and infertility. As a newborn baby, you can see loose skin at the back of the neck due to remnants of fluid-filled cyst, swollen hand and swollen feet due to lymphedema. Let's look at this girl right here with Turner syndrome. So she has a short stature, low set ears are placed below normal position, webbed neck, broad chest with widely spaced nipple. Okay, question number 4. So here we have trisomy XXY, and this is called Klinefelter syndrome. Since there is Y chromosome, the person is a male, but due to one extra X chromosome, so XY is a male, but due to one extra X chromosome, the male has feminine characteristics. So in Turner syndrome, the lady had a short stature. In Klinefelter syndrome, the man has a tall stature with long limbs. But since the man has one extra X chromosome, he has feminine characters like poor beard development, tendency to grow fewer chest hair, breast development, narrow shoulder, wide hip like in females, female type pubic hair pattern, and small testicle or atrophied testicle. Okay, question number 5. Here we have trisomy 21, and this karyotype is of Down syndrome. In Down syndrome, the following features are visible. Number 1, so the gap present between the big toe and the second toe is large, which is called the sandal gap. This gap between the big toe and the second toe, the gap between the big toe and the second toe, it is called the sandal gap. In Down syndrome children, sandal gap is large. Also, there are lots of skin creases on the sole of the feet. The tongue is protruding outside, and the child has a flattened facial feature. There is mongoloid slant of the eye, presence of epicanthal fold, ear are placed lower than its normal position or low set ears, Brosfield spot. So there's your eye, this is the pupil, and here's the colored part of the eye called iris. On the colored part of the eye or the iris, white spots are present, and these white spots are called Brosfield spots. And then a single transverse crease is present on the palm of the hand. This is called simian crease. You can see the simian crease right here as well. The rest of the features, sandal gap is increased, flat facial feature, mongoloid slant, low set ears, protruding tongue, simian crease, low IQ level, Brosfield spot on the eye, on the colored part of the iris of the eye, and that's it.